we'll be able to have this for the future reference for all those that weren't able to make it today. I did get quite a few emails from provosts asking us to please record. So we are going to do that. Right now, I'd like to introduce you to Patty Socken, who is the provost at Touro College graduate and professional divisions in New York. And when she was appointed dean of the Jacob Fuchsberg Touro Law Center in 2012, during her first semester, the academic continuity test was tested as a result of Hurricane Sandy. Now as provost, she has again been challenged to develop, manage, and lead a strategy for academic continuity in light of COVID-19. Patty's going to open with some brief introductory remarks and share her growing checklist of issues, actions, and reporting. And then she will open up the conversation to all participating to share what is happening with your campuses and hopefully to ask questions. So let's welcome Patty.
Thank you, Doreen. And thank you all for joining in what I hope is going to be a lot less of me talking and really more facilitating a conversation, because we are all in the same boat. Some of us are a few days ahead or a few days behind each other as the virus has been traveling and as we have been watching the public response and the various levels of governmental responses to what are best practices and what we should be doing in response to COVID-19. So I just wanted to briefly give some background. Touro College and University System has campuses throughout the United States. I happen to be located in New York, and my jurisdiction is our New York graduate and professional programs. But we have campuses in California, Nevada, and Illinois. And as you know, our United States introduction, I guess, to the virus started really with our colleagues in California. And so a lot of us are looking to California and Washington State now as people that have potentially more experience and more to add to the conversation for us. So in our experience, and a lot has gone on, a lot goes on every single day and every single hour, as you all know. And by the way, before the call, I went on to the CDC website to look at all of the states that have had reported cases. And again, there may be more cases, but these are what are reported to CDC. And out of all the states, there were only 15 states that did not have a reported case. And I'm not sure how long that's actually going to last. But I also don't think the CDC website is up to date, because they also list the number of cases in each state. And I know from the New York State Department of Health website, our number is higher than what the CDC website says. I want to first say we are all on information overload, and sometimes sorting out the facts and trying to get the truth in the right direction has also been a challenge, even in a place like New York. Each county has a health department, and advice that we get from different county health departments is different in terms of best practices. And so that can be challenging, especially for a campus like us that is not a campus on the green altogether. We are spread out across New York State in different counties. And so we have to deal with different jurisdictions in terms of just the health department, not including city government, state government, and of course, federal government, and all of our regulators, not just our regional, soon to be national accreditors for all of us, but many of us have a multitude of specialized accreditors with our graduate and professional programs. So what I'd like to do before I open it up for conversation is just kind of go down a checklist that I put together of things that we started doing a week ago, Monday, on the 2nd, in order to try to prepare for what we anticipated could be a likelihood. And our anticipation was that based on what had been going on the West Coast, that, and based upon what was going on internationally, that it was possible that there could come a point in time when we would have to shift from bricks and mortar delivery of classes to online. And like probably most people on the call, we have had some classes and some programs that are online, but our entire curriculum has not been delivered online. So last week we started with just a simple meeting every other day with all of the deans of our undergraduate and graduate programs in New York. The call has about, fluctuates between 45 and 50 people on the call. In some cases, an academic dean has jumped in. We have also had one call so far with the deans and all of the people who are supervisors, directors, and included some of the administrative staff. So last week it was Monday, Wednesday, Friday, and then starting on Sunday, we went to every day. Sunday, Monday, today, and we'll continue through the rest of the week. And what we had decided to do was, because we had the luxury of time last week, we set up a test for this week with the goal of, we wanted to test our online capability, our tech assistance, our licenses, our faculty training, our students' resiliency. There are lots of issues buried within here. Like, does everybody have access to technology at home? And that's students and faculty. We could talk about staff as a separate issue, but we really wanted to focus on academic continuity, delivery of the curriculum this morning. So with the luxury of time, because we didn't have any cases, it was not really a big deal in New York last Monday. Of course, things have escalated rapidly over the last 10 days. We decided that this week would be a good week to set it up, because it just so happens that yesterday and today, it's a Jewish holiday called Purim, and we have very few, if any, classes scheduled yesterday and today in our academic calendar. So tomorrow is actually the big day for us, because we move about 580 courses online tomorrow. We experimented a little bit with classes yesterday. There are no classes today. So I wanted to share with you some of the things that we have done to get ready for it. In addition to the dean's meetings that I mentioned, last Friday, every dean had a faculty meeting, either virtually or in person, to help update, to continue to update the faculty, but really to get everybody in a room to make the checklist of what the items of concern were from the faculty, what additional training they were going to need. And again, the training had started at the beginning of last week. We've been working closely with the IT department from the beginning to assess our capability. A lot of our faculty had Zoom licenses, but not everybody. And there's different levels of Zoom licenses in terms of the number of students that could be on a call with the faculty member. So last week, we ordered another 600 Zoom licenses to make sure that we got them to our faculty, which, by the way, sometimes we forget. It includes all of our adjunct faculty. And so just because they're not always on campus during the day, they're an important part of the delivery of the curriculum. And in many programs, the adjunct faculty don't participate in regular faculty meetings and weren't on those listservs. And so that was another step that we learned. We got a list of what the faculty felt that they wanted training on. We have set up on on our portal all kinds of videos and PDF documents of how to get on Zoom, how to use Canvas, how to do a whole multitude of things. We just switched to Canvas last year. And so while we'd like to say in a perfect world, everybody was using Canvas, we know that every single person was not. And we also know that we have faculty of all different comfort levels with the use of technology and the belief in whether or not they should use technology for their pedagogy. And of course, starting last week, we no longer made it a choice in terms of people saying it's my academic freedom, they understand that now they can't. And speaking of academic freedom, another issue that came up is that we asked all of the faculty to record their Zoom classes this week. We did that, one, because we may need them in the future, and we thought it was a good test, and we wanted the faculty to know that. But also another item on my checklist has been coordinating with all of the student disability services coordinators that are central and at each of our campuses. And we have students that might need special accommodations as we move to online. And so we've been, and recording the lectures may be one of those things. It may be because of a disability, and it may be because we have students that may not have access to internet, that may not have a smartphone, believe it or not, or that may not be able to afford the data time and the bandwidth and also the minutes on their phones. So we're doing our best to identify who those students might be, but I'm not sure we're going to know that until next week. I see there's a question about closed captioning of all of the recorded lectures. I have asked that question. I don't have an answer yet. I'm not sure if anybody does know the answer to how to close caption lectures that are taught by Zoom, by Canvas, or if you guys have a different platform at your schools. Handling activity courses such as physical education courses, music lessons, music ensembles, etc. I think that for individual music lessons, they could probably be done via Zoom if they're individual or group, the same way as if people were in the same room. It may not be, pardon the pun, pitch perfect, but I think that that's one way of being creative if you have to. I'm not sure about testing how musicians could play together in different places via Zoom, but it might be an interesting test, and there might be some great pedagogical scholarship that comes from this experiment.
Melissa's answer.
Kathy says if you're using Kaltura for capturing video, there's a captioning feature, though we should double check it with our support staff. And then another school, University of Nebraska, is using CC transcription via Echo 360. So courses like swimming and tennis, I think that that's going to be more challenging because, of course, you can't get into the pool, but I wonder if there are techniques or other things that a professor can demonstrate by Zoom that can be replicated by the students, certain strokes, certain exercises, and so forth if it's a physical fitness class. But we have other issues that you raise. Things on my worry list right now is how to deliver all of the lab components of our courses, how to deliver all of the clinical and experiential education. Right now, we have told our students in our health sciences programs and our law school, if the hospitals are open, if the clinic sites are open, if the courts are open, even though your clinic didactic class may be online, you should go to your clinic sites. However, in the last couple of days, we've been getting notifications that some hospitals are asking our students
Stay home too.
because they're not considered essential personnel. And right now, masks are in short supply. Surgical masks are in short supply in the hospitals. And if a hospital has a positive case, they're taking extra precautions as well. And so this is an ongoing challenge. And yesterday, the New York State Education Department issued a document that basically said to the schools, if you have to change the way that you are delivering required clinical hours, you need to let us know. And they have a form and they want to know what it is that we're doing. Some of this is complicated because we're waiting for our specialized accreditors in health science to also tell us what they will accept as substitutes. We have only received information so far from, and you may have other information, I'd love to know about it, from ACPE, from the pharmacy accreditor, saying that they're not going to waive API and IPI hours, and if it means delaying graduation dates or extending the academic calendar, That's their position right now. COCA, which is the accreditor for osteopathic medicine, I am told is going to be sending out some guidance about clinics today. CAPD, which is physical therapy, has just asked us to keep them apprised if we go to contingency plans. I think that, you know, they're trying to figure this out with everybody else. But we are challenged both on clinics right now, especially if we are locked out of them. And New York State says if you're going to do clinic hours or experiential hours by simulation, they want us to provide a whole host of information, including what's the simulation, who's the faculty member that's delivering it, how are they experienced or certified to run the simulations, and then what equipment do we have? And I thought the equipment question was curious because that assumes that the simulations would be on campus at a physical location. So that came out last night at about 5 o'clock, and we're still trying to figure that out.
Patty,
Yes.
we do have one question from Maureen Carvan,
Okay.
who, Maureen, if you'd like to unmute yourself, I know you sent this through the chat in reference to clinicals and clinical placements.
Hi, yes, this is Maureen. So basically, we've been following on, and we actually have an entire list that we've been keeping of information that's coming from our from the accrediting bodies. I'm at Rosalind Franklin University of Medicine and Science, and we are a graduate medical and health professions. And so for us, the clinical and labs is a big deal, which we were still just talking about. So we have this resource, and if you would like us to share it with you, I will see if I can share it with you.
Yeah.
Secondly, we've been talking about basically how do we keep people prepared to go back to clinicals, and if anybody has any ideas about what you might be doing around that, I would also really like to hear about that. And I think Doreen is actually addressing these as she's going, so it's kind of nice to see how that flow is going.
And Maureen, if you want that distributed for everyone, you can go ahead and send it to me, and I'll make sure that they get this along with the recording.
Wonderful, thank you.
Thank you.
So I'm just looking at the questions that are on my screen now also from Diana. How are you handling courses that require facilities on campus, such as organic chemistry labs or ceramic studios? For the organic chemistry labs and other labs, that's another thing that's on my worry plate right now. And we're going to have a call with the faculty that have lab components tomorrow. And we're looking at a whole host of options.
Get that information to everyone.
So I know that there's been some information in the Chronicle, and there's been a lot of circulating information about various options. We really need to see what's available in the universe right now, what creative ideas people have as to what might work. And again, if it's a short-term closure, like a week or two, we know that we could delay things, but we're also thinking about what if it's longer term? And if we look at what's happened in some of the international countries, what if we're closed for not just a week or 2 weeks? What if it's a month? What if it's the rest of the semester? And so we sort of have our contingency plans and our thought process going in a million directions, but trying to keep everybody calm that as of today, we're not closed. And even if a campus physically closes a physical location because there's a positive case, we still intend to deliver the curriculum remotely. And Erica asked if I could repeat who's requiring those specifications for simulations. It's the New York State Education Department. And the only reason I raise it is because I think that all of our state education departments are probably on listservs and probably talking to each other. And, you know, I don't know whose ideas are going to take hold and which ones aren't. And also, it's fluid, and the regulators may change their guidance and may change their instructions as we go. Another hot topic for us has been handling exams. And so with most of our courses not online, We hadn't really thought about the online component of exams before we started our meetings on Monday. And so we have reached out to ProctorU, and we have looked at the capability in Canvas. We also have some schools that have used ExamSoft. But, you know, a lot of the times that we've used ExamSoft, it's been for midterms and finals, not for in-between quizzes and assessments. And so how to do this, how to do it with students that need accommodations. And also we found out from ProctorU last week, I don't know if anybody else has spoken to them, they're covering most of the universities in Italy, and they seem to be strapped as well for resources, and they're changing their pricing structure. And they've put a lot of other, I don't want to call them restrictions, but challenges in place. So, Connie, do you want to add to the conversation? Your perspective? Connie Johnson?
Sure, on the Proctor piece, Patty?
On whatever. I'm just trying
Okay.
to get other people joining in the conversation.
Oh, absolutely, and thank you for calling on me. We're with Colorado Tech. We have 2 campuses in Colorado, as well as a large online population, and we have a large military population as well. And so part of what we're doing is communicating with our military students, because they have some different restrictions as well. Our population are adult students, and so we're trying to understand what they are and what they're not able to do. We also have a doctoral symposium coming up, and we're communicating now with doctoral students, and of course determining whether we'll make we will make exceptions for students who do not want to travel. And we had a clinical lab that we did make accommodations with simulations and other activities so that students didn't have to travel and could comply with the lab requirements. I will say that we sent communication out right away about the COVID-19, but in listening to you, Patty, I'm realizing that who we didn't loop in necessarily were our adjunct faculty as much, and so really appreciate that, because I was just texting the president saying I need to have some adjunct faculty meetings as well. But what we're trying to do is create policies to provide students who still want to attend. I mean, it's a balance right now because we do not have a confirmed their campus, but students who want to attend versus those who do not. And so we're going to be meeting this afternoon again for different policies to make sure that, you know, we're providing students the opportunity to finish their classes. However, students that are opting not to come to campus or travel, that we're working with them as well. Little different, because again, we do have adult students, and so we're not dealing with residential, but we certainly have events all around, and are looking toward, you know, whether we cancel them or not, but how to make sure students don't get harmed as we're going through these protocols. So I appreciate you allowing me to chime in. I know that we were pretty active with the communication, but now it certainly is all the little details that we're working through as well.
So another topic that has arisen is that some of our schools have clinics where we invite people from the public to come in. So we have a dental clinic, we have a speech language pathology clinic, the law school has a clinic. And so we've been putting protocols in place to make sure that as members of the public come in, as patients or clients, that they're also being screened and being told not to come in if they're ill. You know, and we're asking where they have traveled to. So right now, those clinics are still open and functioning, but I understand from the medical schools that have clinics that the masks and some of the safety supplies are beginning to be in short supply. And so we're not sure exactly what the short-term future holds for those as well. Again, I'm going to keep going until people chime in on the chat if you want to add perspectives from your campus, which we would love to hear. Another issue that we have been looking at is all of the events that are scheduled on campus for the months of March and April, and asking the deans what should be rescheduled, what should be canceled. We are following the health department in New York, their rule of thumb, which is large gatherings of 150 people or more. We should seriously think about canceling. And one question for Rosalind Franklin and some of you that have medical schools, next week is typically the big match day celebrations. And I saw this morning that NYIT, their medical school match day has been canceled. At New York Medical College, they have opted to have match day as of now, but to do it outside under a tent and to only allow students and faculty, and they're going to live stream it for parents and family members. And right now we're trying to figure out what to do with our osteopathic medical schools for match day. We were back and forth with that this morning. And so, you know, these are not easy things. Some of them are easy. If it's an event that can be rescheduled, not a big deal. We have a 300+ student IPE event scheduled for the end of next week. And it involves obviously students from lots of different schools, lots of different campuses from within our system. And, you know, my advice to the dean was to try to postpone it and the hopes that we will be able to reschedule it. And for those health sciences programs that have IPE requirements, last year we actually did a pilot program, small scale, on doing some virtual IPE. And we're going to try to see if we can get some small group virtual IPEs going to make sure that requirements are satisfied by the end of the semester, particularly those that are graduating. So just some other questions that have been coming up. What are people thinking about in terms of commencement? That is on my list, but labeled one of those things I hope that we don't have to get there, but we should be thinking about that. And I think we'll know more next month how real that will or won't be. Do you have students studying abroad? Are you recalling any of them? So yesterday for New York, we got a mandate from the governor's office that all New York colleges and universities have to report twice a week the number of students that are studying abroad and what countries they are in. And of course, we had to recall the students from the level 3 countries on the CDC list. So I think everybody may be in a different situation. From what I read, like you guys, it seems that most schools are asking their students to come home. At one of our osteopathic medical schools, we have students on international rotations in Canada, and they're staying there through the end of the academic semester. So that was not as much of an issue for us. But does anybody else have international students right now, or students traveling abroad?
This is Maureen. I'm unmuting because yes, we have both international students. We have students who do rotations, clinical rotations abroad. We have a global health program. So we actually have more than what the federal directive is that they're asking us to report on, which is at this point study abroad, which is minimal in our international sort of exposure, if you will.
Right.
Yeah, so it's a question. All these questions are great. I just want the questions to take back so we can start thinking about them too. But
I'm wondering,
yeah.
Doreen, is it possible to capture all of the questions that are in the chat right now so that we could share the list of questions and comments that are coming up?
Yes, I believe so, and we'll send those out along with the recording.
Great. So Erica's asking, do we have any guidance for faculty overseas in currently affected areas? Are they being allowed to teach remotely? How is the time difference being managed? Does anybody have experience with that? Because that's not something that I have dealt with yet.
So if you'd like to answer, go ahead and just unmute yourself if you'd like to pipe in an answer.
So there's a question asked about searches while classes are being delivered online. Are we doing faculty searches? And let me also add student interviews for programs that require an interview. And our guidance to the faculty at this point, and the way that we have been proceeding, is if the campus is open, even though the courses are online, that they have the option to proceed with the searches in person and to do the student interviews in person. However, I thought that good etiquette at this point necessitates that we offer the candidates the option of also participating virtually, because there are a lot of people that don't want to fly right now. And we want to get the best person possible for these positions. And so I've asked the deans to talk to their faculty search committees and to the faculty that do the student interviews, and to make sure that we take out, any bias that we may have about people's choice to be online, and any bias that we may have how to figure out how to level the playing field between an online interview via Zoom versus in person, so that we are not overlooking exceptional candidates, whether they be for faculty positions or for student interviews. But we are not suspending searches, and we are certainly not closing down our admissions process for next year. Travel has come up, are we suspending travel? So last week, our school, like many other schools, issued a temporary travel policy or an interim policy. And we probably learned from each other as to the checklist of what's in these travel policies. We basically said early last week, and we've sort of been adjusting things as we go along, no travel to any of the countries on the CDC warning lists, and that any students abroad in those countries needed to come home immediately. We said that all non-essential travel, international and domestic, should be canceled. And you know what? At first, we got a lot of pushback from deans and their faculty and students who still wanted to go to the conferences to present papers. Well, a week later, almost all of those conferences were canceled anyway. And so, part of this, how I have felt in being proactive with some of these policies, is I get the feeling that sometimes the deans and the faculty think that we are being unfair, and then a few days later, we're vindicated, because that seems to have been the trend, and it seems to have been the advice from the health department. And so I think that all of us are in a difficult position. With respect to travel reimbursement, this is another thing where you may be working with your finance team. For a lot of the conferences that were canceled, or for travel that we deemed to be non-essential, but people had already booked, how do you deal with covering the cost and making people whole, and at the same time recognizing policies like airline policies? So if I booked my flight, for example, to ACE back in January, and then I cancel the flight, my airline will give me personally the credit, minus the rebooking fee down the road. They're waiving the rebooking fees if you booked your flight in March. A lot of us booked our flights earlier on. A lot of our faculty booked it earlier on. So how are we going to, in good faith with the faculty and the student groups, monitor? We'll make them whole. We're not going to make them have a cost on their credit card, but we want to try to figure out a way that we can keep track somewhat of who's got credits for their travel when we're able to travel again, so that we didn't just give people some additional compensation.
And Patty, I put myself off mute and on camera just because I can add something about travel. As I mentioned before, we do a fair amount of travel, and had literally 20 faculty traveling in March and April, 2 conferences, professional conferences, presenting papers, and also implemented a ban on non-essential travel. Really tough discussions, because then I was presented with, well, I'm driving to a smaller conference, I'm not flying, and just felt for the sake of equity, we needed to say we understand this is not ideal. We know that you have worked hard on this paper, but we have to have equity with what we're saying with non-essential travel. Now, I will say personally, I was heading to Seattle for the EDUCAUSE ELI conference when ELI was canceled on Sunday afternoon. And certainly, as the news unfolded, became more grateful that we did not end up going to Redmond, Washington. Was traveling with University of Central Florida colleagues who also, appreciated. And I know that that was a hard call because some folks were in process, but that's what we're doing here is communicating. We will make you whole, same thing, submit your expense report for any expense that you incurred, but we have to make sure that we're not saying, well, this conference is okay, but this one's not.
Right.
And that's been a tough decision. Now, as the news is unfolded, I think folks absolutely understand and are supporting the decision, because we did this about 10 days ago. But those are tough conversations, and I feel badly because you do have folks who worked hard on those presentations, but we are trying to be consistent so that we're not put in a position that, well, you let someone go, but you're letting me go, and so just wanted to throw that out as well.
No, thank you. So another item to check with your compliance office and your finance office. What is and isn't covered under business interruption insurance coverage for a lot of the increased costs that some of us are going to have to pay for online proctoring of exams, to get some software maybe for some labs, for some experiments at some of the undergraduate levels that we know they're out there, but we certainly can't charge the students for them. And so trying to figure out what events are and aren't covered, what's triggered under your own school's policy is important. Another item that is on my list and that I'm working on after this call is, since we're testing our online capacity this week, we wanted to have a Qualtrics survey ready to go out to faculty and students on Thursday night or Friday morning. We said our experiment was Monday through Thursday of this week. And at this point, we intend to have in-person classes on Friday. And so we just want to get feedback from everybody. And so we've been working on the survey to have it ready to go while it's fresh in everybody's mind. And again, for all of us, I mean, we know that's part of our CQI, so that we can do our jobs even better. We've also been meeting with HR to make sure that we have some flexible work policies, which we have had in place, but now that might be stepped up. How is that going to work? I'm getting emails from deans today that have had requests from people that now want to work remotely from home. And so, this is the balance of moving the courses online and then figuring out what about the rest of the staff that supports the faculty and the academic program in doing what they do, and how are they set up, and what are the capabilities for other important staff to be working remotely. If we have a choice, like right now where I stand, I have a choice. I don't know if I'm going to have a choice next week. And what are the policies if the campus does get closed, but we say the courses are still going on? Are all employees supposed to work from home? Are only those employees that are directly engaged in delivering and supporting the delivery of the courses supposed to be working from home? How are we going to make this happen? So this week, our student services vice president decided to do a test of the student services teams at all of our locations, and on a rolling basis, he's having them all work remotely, but making sure that there is at least one student services person on campus for the day that the rest of their team is working remotely. But immediately the vice president did not send out an email to the deans in advance telling them that that was his plan. And I only found out about it because I got 3 phone calls by 9:15 from deans yesterday morning saying, where is student services?
We need to work on is what I
And so
call
we quickly got that vice president to send an email out to the deans. I think that one of the things that we can do is to help keep communication flowing and transparent, but also being cognizant that people are on email overload right now as well. And so trying to find ways to get our messages read is also another challenge that I think we're having. So Beth asks, any ideas on people who can't seemingly work from home, dining facilities, etc.? We are concerned that we allow most people to work remotely, but not all workers can. And so our president yesterday said that if we closed a campus because of this, that we would pay the employees if we closed because they couldn't come into work. Now, that's different from employees saying, I don't want to get on public transportation. We're in a big city. We have the subways, we have the Long Island Railroad, we have the New Jersey Transit. And, you know, the mayor said yesterday in a press conference, if you can avoid public transportation, you should. Well, how's that for trying to keep public calm and avoid hysteria? And so, you know, we have parents that say they don't want their students, their children to take public transportation. We have some employees who say they feel uncomfortable. And so, you know, we have talked with our, about disability issues. If an employee or a student has a disability that is known to us, of course we would accommodate it if it's documented. But I'm hearing a lot in the last week about people saying they have anxiety, but it's not diagnosed by a medical professional, but people are using the words and the terms and throwing them around. So yes, it is an issue. And also Beth, our facilities vice president, you know, makes the point that he needs the facilities staff to show up on campus, even if the campus is closed, because somebody has to do the deep cleaning if that's the reason for closing the campus. And so it is difficult. And those are conversations we're having. Somebody asked if I can explain the purpose of the survey that I mentioned. The purpose of the survey is to see how did we do on moving classes that were in bricks and mortar to online. Did your class start on time? Did your professor send you the Zoom link timely? Were you able to get onto the classroom? Were you able to participate using the chat function like we are right now? How did you find the experience as compared to in the classroom? What suggestions do you have for the faculty member? And the same thing, we want to hear from the faculty. What are their concerns about how they felt in their ability to communicate the information and to keep conversation going? You know, Zoom has a lot of capabilities, but if you're new to it, for some faculty, it's just enough that they could click on the link and start class and be a sage on the stage for 50 minutes. I have taught on Zoom for a long time. I use the group functions and I divide the students up into classrooms within the Zoom, and I can go and monitor each classroom. We could do problem-based learning by Zoom. Zoom has a lot of great capabilities, but if this is the first time you're doing it, you're probably not getting there yet. So I will share a copy of the survey. There's a question about whether we should have a blanket policy on course evaluations. I'm not sure, but maybe we should add something into our regular course evaluations, a section about the experiment or if it becomes longer term.
And Patty, Maureen has another question. Go ahead, Maureen. If you want.
Okay, thanks. So I'm also, I'm on the board for the Association for the Assessment of Learning in Higher Education. So these are questions that we've been also fielding from multiple professional perspectives across our organization that have been sort of bubbling back up in our ongoing conversation around course evaluations. So I mean, basically there is no official position, so don't take this, but where we're starting to land on is that the purpose of course evaluation is to give feedback that's going to inform the quality of teaching in the classroom going forward and have the institution make decisions that maybe in this particular instance getting more information about how did this experiment work might be more useful than anything having to do with sort of normal operating procedure in a classroom, because they won't have it. So that's just kind of where we're standing right now.
That's great. The other major item on my list is what is everybody doing about campuses that have dorms or student housing? And, you know, particularly planning for what if there is a quarantine. Does the student quarantine in the dorm? Does the student have to quarantine at an off-campus location? If it's an off-campus location and it can't be their personal home or a family member's home, is it ethical to put them in another facility that is not owned by the college? I mean, I'm not sure. Those conversations are starting to occur, and I'd be curious what you all think, if you have any policies or have thought that far yet. Does anybody have any other topics or items that they would like to discuss or raise? We have about 10 minutes left to our hour. Maureen, your hand is still raised on the Zoom. I don't know if that means you want to add something or not. So another thing that I have started to do is put together, for those that are looking on the screen, I've got my confidential Touro College plan. It's about 187 pages right now, documenting what we've done, new policies that we've created. It has samples of communications that have gone out from deans to their faculty, to their students. It has all the communications, official communications that the college has issued. It has we asked all the deans to do their own academic contingency plans. They are works in progress. They're getting feedback from the academic vice presidents and from myself, but those are all in one place. We have, I've been sort of trying every day just to add the bulleted items of issues that have come up, things that we're working on, and trying as best I can to document meetings and notes from those meetings. But to be honest, it's overwhelming at times, because you're also responding real time to questions from all of the deans and the rest of our colleagues in central administration. There's a question, do we want to reconvene in a week? I think it would be great to have these conversations, and I would love for somebody else to take the lead on what's going on their campus, because I'd love to listen in and not be the person speaking, but I am happy to continue to facilitate and do what the group would like. Do we foresee issues in financial aid should classes be canceled? The federal government has issued guidelines. There are webinars that are taking place, and so I think that, yes, we should be talking to our financial aid and student services staff. I see that we have plans for quarantine in place, alternate locations, and then hope that we don't have that many positives. Any campuses considering remote learning before the situation requires it in their area? And I would just say that's what Touro did, because it was not required, and as of today, it is not required. Yesterday, we had one positive staff member with the virus in one of our locations. The person was on campus for just a couple of hours on Monday and Tuesday of last week. And we just found out about it yesterday. And we had to work with the health departments, and we had to get a list of all the people that that staff member had been in contact with. And so there are a couple of people that I think have just opted voluntarily to self-quarantine. The health department did not ask them to. But again, a lot of this is case by case, and what do you mean in close proximity? And I think we're seeing a lot of campuses that are closing because there was a positive person who probably was not in contact with more than a handful of people. Everybody is acting out of an abundance of caution. And what I've kind of learned is an assessment from all of this is that even if we don't think it's necessarily important to close or move the classes online, there's a lot of strength in public perception and what's going on and keeping people calm. And I think that that's another part of all of our jobs is to that we stay centered and balanced on the facts, and that we can keep our faculty, our deans, our students reassured that they are as safe as possible and the risks are not any higher on campus than any place else. Alan, if you would like to jump in for the last 6 or 7 minutes and talk about the disease, you are more than welcome to. We've had a lot of webinars with the health department and our medical school and our School of Public Health, but I think that would be great for everybody to hear.
Okay, first of all, let me know if you can hear me.
You're sounding low.
Okay. Anyway, basically, this is a disease that has what's called an R0 of 2.3 to 2.8, meaning for every one person who is exposed to disease, 2.3 to 2.8 additional people will get the disease. And I'm not sure if I just lost you or not. You still there? So anyway, it is reasonably quickly transmissible. After 5 days of incubation, the next person will have the disease. It will not stop until the transmission rate drops below 1.0. It is estimated that it will cause approximately 3 to 4 million potential hospitalizations during the course of its running. And it is to be viewed as a severe flu-like process. That would be the basics.
Thank you. Does anybody have any questions?
So this is Doreen again, and Patty, thank you so much. We are closing in towards the end of our time. I would like to invite all of you, if you do have questions, CAO does have a members listserv that we would like you to use. So please go ahead and put your questions out on the listserv. If you are not an ACAO member, please send your question to me and I will push it for you, only because I think this is such an important conversation that we're having. And of course, I'd love the chance to talk to you to become a member. So with that, Patty, any closing remarks? And
I think the only thing that I would like to close with is what I closed with the deans on our call this morning. And that is, remember to take care of yourself, because we are taking care of a lot of people right now. And you are all key people on your campuses, and your health is important. And so remember to get sleep, remember to eat, and remember to try to laugh a little bit every day, despite the stress and everything that's going on around you, and to try to get people around you to laugh as well, because they're going to take their cues from all of us. And so, you know, if we appear to be stressed and frazzled and not under control and things are all over the place, that's going to be the message that people take away, and that message is going to fly like a game of telephone. And so keeping calm, keeping informed, trying to keep things moving and being as responsive as possible, but also taking care of yourself. And I think that we will all get through this together and have a lot to debrief on this summer. So I want to thank you for the opportunity to facilitate the conversation and to share and to learn with all of you.
thank you, everyone. And with that, we will be ending our discussion today. Bye-bye.